Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop tension headache pain, especially at home. This is a very special topic to me because after my second cancer treatment, I used to suffer from tension headache almost on a daily basis. And I will go over the steps that I personally used on myself and a lot of my patients, and had a great success on eliminating, stopping, or even not having tension headache in the future. So make sure you watch this video to the end because the information that I will present it will make a lot of sense what you can do at home to really stop tension headache. So before we start, we really need to understand what is tension headache, the symptoms of tension headaches, the causes, the risk factors, and then we'll go over what you can do at home to stop tension headache. So first, what is tension headache? You will feel like a tight band. A lot of patients describe it as like you feel a band over your forehead like this. And also you could feel dull, achy pain, pressure over the head, and muscle tightness in the neck area and the occipital area right here. You feel tired, you feel irritable, and trouble focusing. So when we look at these pictures here, it shows several different presentation of tension headache. And you can see it here in this area, like from the first image. You could have it in this area, and that's very typical when you start to have like TMJ, and this is actually related to TMJ too, jaw pain. And I will go over how to stop jaw pain in other video. And it's also jaw pain cause tension headache, so make sure you watch that video. So you could have it like a band in this area, or band around on the front or the side, or you can have it like a band like this in the occipital area from the top of your head going down to your neck. And some people could feel it in SCM. You see it here in this area across the neck with some eye tightness around the eye and the back of the head. I don't want you to worry about this. It's kind of like different way of presentation of the tension headache. But when you experience tension headache, you might have any of these or combination of those. So you also could have it on the top of your head, or like in this image, it's like a U shape here. So what are the causes of tension headache? So one of the most common causes is poor posture, and I go over the proper posture in other video because there's a lot more to learn and to do. Make sure you watch the other video to how to correct your posture. So posture, when you slouch forward, that will start to have a lot of scar tissue, a lot of tightness in your fascia, in the neck area and in the forehead. And that will cause tension headache. Stress cause tension headache. Drinking alcohol, infection, caffeine. If you have an eye strain or your vision is not really the best, and you're squinting, you will start to have fascial restriction in the forehead. You start to build a scar tissue, and that could cause a tension headache. Dental problems. If you clench or grind your teeth, you will start to have a lot of scar tissue, a lot of tightness in the masseter muscle and temporalis, and that will cause tension headache. I go over how to stop jaw pain in another video. Smokers and fatigue. So those are actually the causes of tension headache. Why it's so important? Because a lot of these can be eliminated at home, and I will go over how to do that at home. So how to treat the tension headache? Before I answer this question, we need to understand how our body normally heal, because when we understand the normal healing cycle, it will make a lot of sense how to treat it properly. So I'm gonna use external paper cut for visualization, but the same process happen internally from the tension headache. When you start to have like poor posture for a very long time, you start to have micro tear in your muscle and in your fascial layer, and you start the healing cycle, but you don't see it because it's happening internally. So I want you to be able to visualize what is going on internally by looking at the normal healing cycle. So I'm going to use external paper cut here for visualization. So the first stage of healing is inflammation, as you see in the first image, swelling, redness, the blood start to rush to that area, pain, and decreased function. Second stage is a proliferation stage. That's when the body starts to build the scar tissue, as you see in the image. During that stage, there's actually a cascade of events: fascial restrictions, muscle spasm, trigger point. So, and I'm gonna focus on the scar tissue for the sake of our time, but I have another video explaining in detail the fascial restriction, the muscle spasm, and the trigger points. So why scar tissue could be an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, it should stretch like this. So when you have a scar tissue, it's like you have another rubber band. So when your muscle contracts, will not stretch much. So for example, if you have really a poor posture for a very long time, you start to build you start to have micro tear in the muscle, and when that's happened, your body starts to build the scar tissue. We actually need the scar tissue. Scar tissue is like the glue that glued the tissue that had a tear. We need a scar tissue. The problem when we have too much scar tissue, the length of that muscle decrease. So when that happens, that compress on nerve and artery, decrease the blood flow to the brain, and also cause a lot of tightness. In perfect scenario, actually during the maturation stage, our body should get rid of the scar tissue by itself. That could take days, weeks, months, or years. And if you have the trigger on a daily basis, like poor posture, poor body mechanic, and other trigger causes that we went over, you're not giving time to your body to heal or recover. So we have to eliminate the trigger. At the same time, we have to break the healing cycle, the vicious chronic condition of inflammation, proliferation, if you are going back and forth. So this is a good image to visualize what's look like for the muscle or the tissue. This is the first image is normal healthy tissue. There is no issue here. Nice and clean tissues. When you start to have injury, you start to have tear like this, and that's what look like internally. When you start to build the scar tissue, this is what happened, scarring the area. The problem when that too much is built up, you will feel like when you palpate, you feel like a nod. You will feel like a nod. You will feel like grinding feeling, or a band, and that's very typical for a scar tissue buildup or fascial restrictions. So, what kind of treatment we can do to treat the tension headache? Before I start, I'll go over the effective treatment. I will go over what currently used that doesn't work, so you don't have to waste your time on it. So, and we're gonna relate that to the normal healing cycle. So, ice and heat, that's used to temporarily decrease pain. But when we look at the healing cycle, it's not gonna really decrease the inflammation much or do anything in the proliferation stage, which is breaking scar tissue or releasing fascia. The other thing that's used in a lot of clinic is electrical stimulation. It provides temporary pain relief for half an hour to an hour if you're lucky, but does not do anything to inflammation or proliferation, so basically masking the symptoms. The other thing used is foam roller, and foam roller, based on several studies, that does not provide long-term pain relief, and it's a very superficial that actually does not induce a lot of physiological effect, especially for the deep tissue. So when we look at the healing cycle, what it's gonna do, actually, if you rub over inflamed area, it's gonna be inflamed more. And it's not gonna break deep adhesion or scar tissue or fascial restrictions. Massage is the same thing. Instead of foam roller, you're just using your hand to massage that area, but technically it's hard to really release the fascia with the massage and release the scar tissue. You have to go really deep and targeting those tissue, and several studies shows it does not provide long term. So stretching, and I personally do not recommend it for my patient, and I have a video why you should not stretch. There's much different. There's other approaches that more effective and less aggressive than stretching. If you overstretch, you're gonna cause more inflammation. So there is possibility of harming yourself if you stretch. Feel free to check the other video about why you should not stretch. So strength exercise, we need to do that, but we need to introduce it in the right time, because if we introduce it in the inflammation stage, you're gonna inflame it more. Okay, so how to treat it effectively? So we need to look at the body as two stages, the inflammation and proliferation. We need to figure out, are you stuck in the inflammation proliferation stage or in the proliferation stage by itself? A lot of tension headache patients, they actually typically stuck in the proliferation stage by itself. Not a lot of inflammation. So when you release the scar tissue, fascial restrictions, muscle spasm, and correcting your posture, a lot of those patients respond very well. But I'm gonna go over those two stages and how to address them, so you will know what to do in each stage if it's applicable to you. So inflammation stage, what I personally use, I use the MagnaHeal. It's a very strong magnetic belt that can be used from head to toe. Actually, you can see it here, that the model using it on her head. So we measured the magnetic field. It was around 3 inches depth. So that's what I use for inflammation. If it's mild inflammation, that's worked very well. If someone has really severe inflammation, we put them on an anti-inflammatory diet. And as you see here from the causes, and this is what you need to avoid at home, alcohol, that's a trigger. And part of the anti-inflammatory diet is avoiding alcohol. Caffeine is a trigger, so those are part of anti-inflammatory diet. I prefer to put all my patients on anti-inflammatory diet because, for example, refined carb, refined sugar, when you eat the food that include refined carb and refined sugar, that puts your body in inflammation for 5 hours. So if you eat 3 meals a day, that inflammatory, your body in internal inflammation for 15 hours. So that's why it's important to really follow the anti-inflammatory diet, and I will have other videos explaining part of this diet in the future. So the other thing that's very important and overlooked by a lot of healthcare providers, that if you have deficiency, your body gonna be in chronic inflammation because you need like magnesium, you need D, you need B, you need other vitamins and minerals for your body to transition from inflammation stage to proliferation stage to maturation stage. But if you're missing any vitamins or minerals that require for that transition, your body gonna go back and forth between inflammation and proliferation. So even if you do the anti-inflammatory diet or using the MagnaHeal, that will work very well for mild inflammation and moderate inflammation. But if you have magnesium, D, C, or other vitamins and mineral deficiency, you have to replace it. Okay, what to do if you have inflammation? Well, you need to know if you have inflammation or not. So one of the easiest way to do that is take advantage of Ask ASTR. It's free online medical evaluation. It takes about 5 minutes. The software includes at least 9 healthcare provider database, and the software will evaluate your nutrition, your hormones, any vitamins and mineral that could possibly have deficiency, and the software will guide you what steps you need to take to really overcome those deficiency. So take advantage of that. So the second thing, we're gonna work on the proliferation stage, and that's extremely important for tension headache. And if you don't work on the proliferation stage, you're not gonna be able to release the tension headache, because by definition, you will have a lot of scar tissue, a lot of tightness in your fascia, in the forehead, in the head area, in the neck area. So if you don't release that, if you're using massage, that's temporary. It's not gonna release the tightness, and it will make sense when I go over each part of the proliferation now. So the scar tissue, we need to really release the superficial and deep scar tissue. So what I use is the A3, and I personally, if I have any issue in the headache in the morning or any time I feel like it's coming, that I start to work on myself, actually, to break the scar tissue. That's working on releasing the superficial scar tissue. For deep scar tissue, I use the A5. At the same time, the same tool, the A5, we use it to release trigger points, because it's very common to have trigger points and with the tension headache. So I use the A5 to really go deep, to release deep scar tissue, deep fascia restrictions. Briefly, I'm gonna go over the fascia system because it's extremely important and it's extremely overlooked by a lot of healthcare providers. And that is one of the, I personally experienced that in myself and in a lot of my patients. Fascia restriction, extremely common with the tension headache. If you don't release fascia, it's hard to get a long-term release or relief for tension headache, period. So fascia system, as you see here, this is a white web look like tissue. That's the fascia system. The fascia, the superficial fascia layer, it's wrapped surrounding the entire body. It's a very thin layer wrapping the entire body. That's a superficial layer. But we have several other layers. The body divided to two main categories of fascia, superficial layer and deep layer. And each category of these is divided or has 2 to 3 sublayers. So the superficial layer have 2 to 3 sublayers, and the deep layer, each of the subcategories of the deep layer has 2 to 3 layers. So the deep layers, and it's a very complex system. That's why you need several tools to release it. But don't worry, the treatment is extremely simple. But I want you to understand the complexity of the system to really appreciate why it's important to treat it, especially for tension headache. When you feel like a band or a rope, that is typically a fascia restriction and extremely overlooked by a lot of healthcare providers. So apparatic fascia is a fascia layer that's wrapping a group of muscles. The epimysin is wrapping each individual muscle fiber, and the premiysin that's wrapping a group of bundle of fibers, and you can see it here in this image. And at the end you have the endomysin wrapping each individual fiber. So we have a lot of different fascia layer. That's why massage and foam roller does not work to release fascia, because it's hard to isolate these with just rubbing with the hand. And also the finger, the elbow, or the foam roller are not gonna go deep enough as the A5 to really release the deep fascia restrictions. And I want to show you an image for the head area, and you can see this, the white tissue here, those are the fascia. You can see here on the top the glia aponeurotica, that is the fascia layer that's wrapping here. So if you don't release that, you're not treating the tension headache, period. So as you can see here, it's attached from here, from the front of your head, all the way to your occipital area, occipital muscles. And you have fascia layer attached here and around your face. So it's a very complex system. It's everywhere. We cannot ignore it to really treat tension headache. So how we treat it? I use the A1 to really release superficial fascia layer. It's very easy to use, and I actually use it on myself, and I teach patients how to do it in themselves. And with the A1, you really can release the superficial fascia layer and the apparatic fascia layer. For the deep fascia layer, that the epimysin, premiysin, and endomysin, I can go deep with the A5, which is really hard with massage. Use your knuckle or your elbow to really go deep, and this is very targeting to really work on the trigger point and the deep fascia restrictions. So what can you do at home to really take care of tension headache? First thing, what you can do is eliminate the triggers. Poor posture, extremely common trigger. So check out our video that I have about posture. You need to correct your posture, your sitting posture, your computer posture, your walking posture. Dental work. If you have any dental work, I have another video on how to decrease your risk after having dental work from tension headache. And also, if you clenching or grinding your teeth, check how to stop jaw pain video, because there's some tips you have to do at home to really decrease the clenching or grinding, or actually totally stop it. If you have eye issue or vision issue, you need to check with your eye doctor, because if you constantly squinting and in the front of the computer or while you're driving, that is causing a lot of micro tear in these areas, fascia restriction, and gonna cause tension headache. So we need to address the root cause of the problem if that's an issue. If you're a smoker, I recommend, or you drink alcohol, avoid that as soon as possible. It's not only causing tension headache, that's increasing your risk of cancer and a lot of other health issue. So that's what you can do at home. Okay, but if you have chronic inflammation and or you're stuck in a proliferation stage, we need to work on the healing cycle simultaneously, the inflammation and proliferation stage. As I mentioned, for inflammation, I use a MagnaHeal, the anti-inflammatory diet, and try to figure out if you have deficiency. That's usually with the chronic inflammation. It's very typical with tension headache that patient usually stuck in a proliferation stage, and that's what we need to do to address all aspect of the proliferation stage. That's why one of the common question, I was like, can I use only one tool to break the scar tissue? I'm like, but this tool is not gonna release fascia restrictions. And when you look at the proliferation stage, we have to work on all the elements of the problem, because when you start to have a scar tissue, you start to have fascia restrictions, you start to have muscle tightness, which is actually muscle spasm, and you feel nodes, which is actually could be a trigger point or scar tissue. So we have to address all of that simultaneously in order to get to maturation stage to clear up everything. So if you have any question, leave it in the comment section below, and I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.